LiberalViewer presents.
So, welcome to the September 13th edition of LiberalViewer Monday Media Mixup. Thanks for joining me. I'll be using the 11 best, most newsworthy clips I picked out from the Sunday morning news analysis shows from the big five corporate outlets of ABC, NBC, CBS, CNN, and Fox News, the so-called corporate media here in the United States, for which would be a really educational, informative, fair use media criticism and political commentary show for you all today. My topic, and pretty much all the clips except parts of the news summaries will stray onto other topics, but all my newsmaker clips are on Biden's mandate that some businesses, that is businesses with over 100 employees, will have to either vaccinate their workers or institute weekly testing of their workers. And I put or test weekly in all caps in my title because that part seems to be left out in a lot of the reporting or in a lot of the discussion. And I'll show you some examples of that when I get to the clips, because it's not, no one is required to get vaccinated as long as they're willing to get tested. And even if you don't want to get vaccinated or tested, then I guess you can't have that job, which is a problem. I mean, it's definitely an imposition and a burden, but it may be outweighed by the compelling state interest in the health of the general population. I mean, 600,000 plus people have died. And anyway, I'll discuss the legality and the advisability of the vaccine mandate. Now, I'm calling it a vaccine mandate for short, but I made clear it's vaccine or weekly testing. And I'll get to all that with the news summaries and the newsmaker clips. But first, I want to start off with, I mean, this clip isn't comedic, but it's a political comedian, Bill Maher, and he's misstating science while claiming to be a supporter of the science. So he has this pet peeve that he's basically, I guess, because he's thin and he thinks of himself as healthy, despite the fact he does use some drugs and drink, but he sees himself as healthy, and he's sort of borderline been anti-vaccination, and he's not against vaccines, and they sort of discuss the vaccine mandate on the show. You can't find this clip on the real-time YouTube channel, but here you'll see Bill Maher misstates a CDC study about how many people who have died from COVID-19 in the United States were obese. And anyway, I will talk about all of that a little more with you after we watch. I've edited together two parts of what Bill Maher was saying. The part where he's saying 78% or 4 out of 5 people who died were obese, and I'll show the actual source and talk about how significant that fact is after we watch that clip together over here.
I mean, I'm for all getting the country back on its feet, and if it takes a lot of vaccines to do that, I understand that to a degree. But, it is predicated on this idea that we are all equally vulnerable, and we're not. And a lot of it has to do with lifestyle choices, which we just refuse to talk about. I hate to be the one who has to always say it, but 78% of the people who died from this were obese. The vast number of people in the world who have died from it were in countries where that is a problem. They keep saying, let the science speak, listen to the science. This is what the science is screaming loud and clear. And unless people have some skin in the game, even before COVID, we're never going to get a handle on our biggest problem with the economy also, which is healthcare. People have to take some responsibility for their own health. They have to meet the government halfway.
And this virus does not know sort of people's personal habits. Like it is.
No, but it knows this. It knows this. That's 4/5 is kind of a big number.
The most efficient
for one factor.
Now, I found that sounded like it was a little bit high to me, and so I did some Googling, and I did find 78% of people who died between March and December of 2020 in the United States from COVID-19 were obese or overweight, because there's a category between healthy weight and obesity, just overweight. This is something I know well because I am personally overweight but not obese. And if you look at the study, I put a link down in the video description to this study from March 2021. And the first screenshot I want to show you from that is here. You can see of the adults, the 150,000 adults in this study, 28.3% were overweight, and 50.8% had obesity. Not 78%, 50.8% were obesity. If you add those two together, then you get Bill Maher's 78%. But even more important, you may think, well, still half the people were obese. But look at this. 50.8% of the patients in the analysis had obesity, compared with 43.1% in the total population and 42.4% nationally. So it's actually the 50% of people being obese is pretty close to the 43% in the population. And now one more fact to add in there, that they didn't have the obesity rating for all the people. See, it says only patients with reported height and weight information were included. Among the 238 hospitals, 28% of the patients were missing height and weight information. So that means they didn't have data on 28% of the people, and that's especially skews the data because if someone is obese, the medical staff is much more likely to document their height and weight because, as it says in that study, I mean, obesity is a risk factor for like diabetes and other conditions. I'm not saying obesity is good, but I'm saying the data there is skewed because they would have noted obesity pretty much in all the obese patients. So a lot of the 28% without height and weight probably weren't obese. So that skewed the data so that it looks more like the amount of people with obesity who died in that study is really close to the amount of people in the population who are obese, which means it wasn't really a significant factor. But anyway, so I just wanted to deconstruct or debunk Bill Maher's first misstating of the number and then using this one specific study that has some flaws to, you know, what he wants to be able to do is fat shame, I think. Bill Maher liked to make fat jokes in the past, and because he thinks fat people are irresponsible, you know, they deserve to be fat shamed, I guess. I don't know. That's my analysis, having watched Bill Maher for a long time, but you can let me know what you think down in the comment section. But I think you have to agree that Bill Maher was misstating the science there, using a study, exaggerating, maybe even creating a significance of obesity that might not be there at all because of the flaws in that study. Anyway, now it's time to move on to the news summaries, which all covered Biden's vaccine mandate, or I should say vaccine or testing mandate for businesses with over 100 employees. Also, federal employees must be vaccinated. Healthcare workers at hospitals that receive Medicare, Medicaid funding also must be vaccinated. So there is a significant mandate, but it's not just everyone has to get vaccinated, as some people have been discussing it. And I want to compare the 5 different news summaries now from longest to shortest and see which one gives the best information on this. They all seem to like compare, because this was the 20th anniversary of 9/11 yesterday. They all tried to bring that in. I think all 4 out of the 5 of them tried to bring in 9/11 into the analysis. Maybe all 5, but I'll start with Chuck Todd, who as usual has the longest and best package. Well, because he starts with his live introduction and then goes to this pre-recorded package. A little over 4 minutes of news summary that I will talk about with you a little more after we watch it together over here.
Well, good Sunday morning. This past week, we have been marking the 20th anniversary of September 11th. After nearly 3,000 Americans were killed during the terror attacks, the country pulled together as one. For a while, at least, the spirit of September 12th helped the country divided over the 2000 election unite against a common enemy. Not so now in the fight against our current enemy, COVID-19, where the red-blue conservative liberal dividing line now separates the unvaccinated from the vaccinated. In fact, 2 days ago, we woke up to the news that 3,160 Americans had died of COVID over a 24-hour period, almost all of them unvaccinated, and it was a higher death toll than those 9/11 terror attacks. It was against this backdrop of an upward slope of death and disease and a downward slope in his own approval ratings that President Biden threw away the carrots and brought out the sticks. He's no longer asking the unvaccinated to get a shot. He's telling them. Many Republican lawmakers and candidates called it government overreach, while more than a few health experts said it's about time. Whatever the merits of this plan, the fact that Mr. Biden felt it necessary to take this step was itself a concession that the current strategy against COVID isn't working.
We've been patient, but our patience is wearing thin.
President Biden, whose presidency rests on his ability to get the pandemic under control, announced a sweeping vaccine mandate for employers this week, a move he had long hoped to avoid.
My message to unvaccinated Americans is this: what more is there to wait for?
Within hours, the Republican National Committee threatened to sue, and Republican governors promised to fight the administration even to the gates of hell, with most threatening to challenge the rules.
What the Biden administration is doing is government overreach, pure and simple.
This is a power grab by the federal government.
My legal team is already working.
Nebraska will push back, fight back with any tool we can find.
Have at it. We're playing for real here. This isn't a game.
The mandates are an about-face for Mr. Biden, who for months resisted them.
I don't think it should be mandatory. I wouldn't demand to be mandatory.
On Friday, the CDC released a study showing unvaccinated people are 4.5 times more likely to become infected than the vaccinated, 10 times more likely to be hospitalized, and 11 times more likely to die.
This entire unit is filled with unvaccinated COVID patients.
Some employers are welcoming the sweeping new rules, which require roughly 100 million Americans to get vaccinated, including federal employees and contractors, more than 17 million healthcare workers at hospitals and other sites that receive Medicare or Medicaid funding, and employees of businesses with 100 or more workers, who could be required to be vaccinated or tested weekly.
This is something that we're embracing and we believe in.
But Americans are sharply divided. 48% favor a vaccine mandate, 52% oppose it, including 79% of Republicans. When asked about an employer mandate, support does grow. 52% support a business requirement, 45% oppose.
I've been waiting and hoping that he would do something, and I agree with it 100%.
I think he's gone too far. You can't make people get an injection.
Biden's move comes after months of attempts to persuade the unvaccinated.
This is your choice. It's life and death.
Early declarations of victory.
Today, we're closer than ever to declaring our independence from a deadly virus.
And several missteps, including the decision in May to very publicly tell the vaccinated to take off their masks.
If you've been fully vaccinated, you no longer need to wear a mask.
And confusion now over booster shots.
The question raised is, should it be shorter than 8 months, or should it be as little as 5 months?
That guidance continues to be 8 months. That has not changed.
And joining me now is the U.S. Surgeon General, Dr. Vivek Murthy. Dr. Murthy, welcome back.
And I actually will have 2 Surgeon General clips, not the one of Chuck Todd on Meet the Press, because I also wanted to have a couple Republican governors who oppose this vaccine or testing mandate. And one of them, the more reasonable one, Governor Asa Hutchinson from Arkansas, was on Meet the Press. So that will be clip number 10. And then clip number 11 is the Fox News Sunday interview of Governor Pete Ricketts of Nebraska. But I will have 2 Dr. Vivek Murthy clips and then a Dr. Scott Gottlieb clip. Those are my 5 newsmaker clips after my 5 news summaries. Now, I thought, if anything, the NBC News is often accused of being too pro-Biden, too softball on the administration. And I thought, if anything, that news summary was extra critical of missteps by the Biden administration and changes in position, and I think laid all that out pretty well. And not that the Biden administration doesn't deserve criticism for all the points that Chuck Todd made in his best and longest package there, but I think there's some criticism for Republicans, Governor Ron DeSantis of Florida, that I think is stressed a little bit more over in CBS News' Face the Nation news summary, the second longest one. Mark Strassmann's back this week, and this was the first week I noticed that his name has two N's at the end. Strassmann, I guess, Strassmann. And so I've been misspelling it all this time. I've spelled it right. Down in the video description, you can see summaries of what's in every single one of the clips. Followed, that's in my media mention section, and then below that in the sources section I have the source of all my clips, including that CDC study, the Bill Maher blog, because I can't find that clip online. But anyway, here is the CBS News Face the Nation news summary. Margaret Brennan, back from maternity leave this week, never mentions it at the beginning, doesn't mention it till like the last 20 seconds of the show. I'm not sure why that is, but Margaret Brennan, Mark Strassmann, together again, talking about COVID again over here.
Good morning and welcome to Face the Nation. Yesterday, Americans marked a somber milestone. 20 years since the September 11th attack, an event that upended American life and launched the war on terror. We'll have more on national security later in the broadcast. But this morning, Americans are waking up to another threat. The Delta variant continues its unrelenting spread. President Biden now faces a slowing economy, and his frustration with the 80 million Americans who remain unvaccinated is clear. He's now requiring federal workers to take the vaccine and mandating some private businesses to do so too, or submit to weekly testing. But that order could soon face legal challenges. CBS senior national correspondent Mark Strassmann is in Atlanta with the latest on COVID's impact.
COVID's back-to-school lesson: how vulnerable kids are, making up more than 1 in 4 new COVID cases.
How do other parents, how are they okay with that? How are they just okay with that over, a mask?
For the sickest COVID kids, hospitalization rates spiked almost tenfold since late June. Alarm in Los Angeles. America's second largest school district just mandated vaccinations for eligible students.
That's why there isn't measles and mumps and rubella in our schools, because we vaccinate and we require it.
These 9 states have banned or restricted school masking mandates, including Florida. On Friday, a judge upheld the governor's ban.
Let the parents make the decision that's best for their kids. If you want the mask, do it. If you don't, don't. That's fine.
But Florida's pandemic politics has consequences. In Miami, Abe Coleman, an elementary school math teacher for 3 decades, died of COVID.
He was just a great coworker to many people and had stayed at the school like a monument.
Coleman became one of 13 Miami-Dade teachers and staff to die of the virus already this school year, all of them unvaccinated. COVID also killed more than 2,400 Floridians last week, another state record. 4 were children under 16. With the unvaccinated, many college campuses have gone from pleading to punishing. Ohio State will deny them housing and in-person classes next spring. At Quinnipiac University, fines of up to $200 a week. More than 700 colleges and universities have mandated vaccines.
I think it's a massive overstep of their authority.
But this ICU in Boise, Idaho, largely reflects COVID America today. Every COVID patient is unvaccinated.
And they all ask, well, what could I have done? Will the vaccine save them now? No.
Pfizer's vaccine for kids between the ages of 5 and 11 reportedly could get FDA approval by the end of next month. Communities like Metro Atlanta could use the help. Roughly 25,000 kids have tested positive in the first 6 weeks of school. Margaret?
Thank you very much. Well, we want to go now to former FDA Commissioner Dr. Scott Gottlieb, who...
Yeah, and I will have Dr. Scott Gottlieb on giving his opinion that vaccine mandates hurt the cause of vaccination, and I'll talk about that when I get to it. I did mention before I showed that clip that I thought that CBS News' Face the Nation did a better job of criticizing Republicans, especially Florida's Ron DeSantis, as you saw there. And the other thing I thought that clip emphasized really well was the increasing threat to children from this Delta variant. And there's more and more scientific data showing that it is more of a threat to children than the initial strain was. And that's important because you'll see the Republican governors, that's one of the things they always point to, is how the original strain was not much of a threat to children, but they're using old data to make that argument. So I wanted to point that out. The next news summary, not critical of Republicans. It has a lot, mostly the facts about the vaccine or testing mandate. The next one's the Fox News Sunday news summary from Chris Wallace and their reporter, Mark Meredith. It's actually kind of the reverse of how things often went in terms of the Fox News bias on Fox News Sunday. I'd point out that they'd leave out some important fact in the news summary, but then Chris Wallace would make up for it by asking one of the newsmakers about it. But this time it's kind of a reverse because they actually talk about how it's for the vaccine mandate for employers includes the possibility of weekly testing. That's in the news summary, but Chris Wallace completely fails to bring that up when Governor Pete Ricketts of Nebraska keeps acting like people are going to lose their jobs if they don't get vaccinated. And that's the final clip, so just keep that in mind as we watch the Fox News Sunday news summary together over here.
Hello again from Fox News, today from our brand new studio here in Washington. On this 20th anniversary weekend of 9/11, I'm sure many of you are still reflecting on that roll call of names we heard again yesterday. People of all races and religions that fell like teardrops on our hearts. It never gets easier, and maybe that's the point. We'll have much more on 9/11, 20 years out, and where we stand in the war on terror later this hour. But we begin with breaking news. President Biden's new mandate that millions of workers get vaccinated or test for COVID weekly has created new battle lines in the fight over the virus. Amid accusations of federal government overreach, some 19 Republican governors are now threatening to, as one of them put it, fight to the gates of hell. In a moment, we'll speak with one of the governors, Pete Ricketts of Nebraska. But first, let's bring in Mark Meredith at the White House with a look at the brewing battle. Mark.
Chris, the president insists sweeping new mandates are necessary to convince some 80 million unvaccinated Americans that now is the time to get the shot. But critics argue the president is overstepping his authority, and they're vowing to fight back.
We're playing for real here. This isn't a game.
President Biden is brushing off looming legal challenges to new vaccine mandates. He says starting soon, OSHA will require employers with more than 100 people mandate vaccinations or require employees who opt out to undergo weekly testing. More federal workers and contractors will be required to be vaccinated in order to keep their jobs, and the TSA is doubling the minimum fine for travelers who violate the mask mandate.
My message to unvaccinated Americans is this. What more is there to wait for? What more do you need to see?
But several GOP governors claim the president is going too far, arguing American businesses should not be forced to police employees' medical choices.
I do not believe that people should lose their jobs over this issue, and we will fight that.
The White House admits there are limits to what it can mandate for schools. It's urging governors require school employees be vaccinated. In Los Angeles, the nation's second largest school district, officials going even further. Soon, every student 12 and older will need to be vaccinated to attend in-person classes. Tomorrow, the president's going to be hitting the road off to Idaho to get an update on how the government is battling wildfires. Then he's going to California to campaign for embattled Governor Gavin Newsom, whose recall election, Chris, has been dominated by his response to the pandemic. Chris.
Mark Meredith reporting from the White House. Mark, thank you. And joining us now, the governor of Nebraska, Pete Ricketts.
And like I said, I will have that governor of Nebraska interview or parts of it later. Mark Meredith did mention President Biden is coming to California. He's actually going to be in my hometown here, Sacramento, later today. But I checked. I couldn't figure out a place where I might be able to go and take video of him. But at least mention the fires. That's one thing. Didn't get a lot of mention. The ongoing problems with climate change. But that, I guess, we move from story to story so fast every week, and it's time to move on to vaccine mandates, and of course it is, I just double checked my notes, all 5 of the news summaries somehow brought in the 20th anniversary of September 11th. And I especially like how you saw how Meet the Press said last Thursday there were just about as many deaths from COVID as from September 11th. And that was something I thought a lot about this anniversary, was how that was like created this 20-year war and trillions of dollars spent, and this whole change, and especially from the right-wing national security people really wanted to change everything about America because of the 3,000 people who died on September 11th, 2001. But when that many people are dying every day or every couple days at this point, a year and a half into this pandemic, not willing to wear masks, not willing to have workplace safety regulations that require people to be vaccinated or weekly tested if there are more than 100 people there, which means that it's a place where COVID could easily spread. So it's, the 100 or more employees is actually directly related to the state's compelling interest in the health of workers, which, the OSHA law was created it's the Occupational Safety and Health Administration, creates regulations to promote workplace health and safety. And, this may be an unprecedented regulation, but OSHA wasn't around back for the 1918 worldwide flu pandemic. This is the first time that we've had this type of workplace safety bureaucracy since 1918. So, of course, it's going to be a new type of regulation. Anyway, I want to show the last 2 of the news summaries before I can get to the newsmaker clips. The next one, ABC's This Week with George Stephanopoulos, covers, the same territory, also with the September 11th comparison that I will talk about with you a little more after we watch together over here.
Good morning and welcome to This Week, a week where we've remembered the toll of those attacks that transformed our country 20 years ago. President Biden led the commemoration yesterday with ceremonies at Ground Zero. Shanksville.
We are gathered today on hallowed ground.
And the Pentagon. And the president returns to the White House this week to address what may be the greatest threat to our country since 9/11. For 18 months, the COVID pandemic has consumed our country. And now, even though 75% of American adults are vaccinated, it's become a pandemic of the unvaccinated. With more than 100,000 cases a day for 4 weeks, last week, roughly 250,000 new cases reported among children, the highest total yet. But Biden's plan to mandate vaccinations at workplaces across America is facing swift and severe resistance, drawing attacks and threats of legal action from at least 19 Republican governors. We're going to begin there this morning with Surgeon General Vivek Murthy.
Hello, I'm Dana Bash in Washington.
Sorry, hit the wrong clip there. Almost went to the Dana Bash clip. Like I said, I'm about to have 2 Vivek Murthy clips. You're going to compare, actually, Dana Bash's interview of Vivek Murthy with George Stephanopoulos'. I think, actually, George Stephanopoulos does a worse job. But that news summary was fine. It was brief, and not quite as brief as the CNN State of the Union news summary from Dana Bash, covering same territory, 9/11, COVID pandemic, which I will talk about with you a little more after we watch the final of the quintet news summaries together over here.
Hello, I'm Dana Bash in Washington, where the State of our Union is remembering America's horror and heroics. Yesterday, America marked 20 years since the terror attacks of September 11, 2001, and in some ways, reliving the way Americans came together 2 decades ago put a spotlight on how much things have changed. President Biden spent the day honoring those killed on 9/11 with trips to Ground Zero, Shanksville, Pennsylvania, and the Pentagon, even as many Americans have grown numb to the thousands now dying each week, largely preventable deaths from COVID-19. This weekend, Republican governors are lining up against President Biden's most aggressive push yet to get the pandemic under control, vowing to fight a new vaccine mandate covering as many as 100 million Americans. One model used by the CDC projects almost 100,000 more could die by December. Joining me now is the
And I'm about to show you that Vivek Murthy interview, but actually first I'm going to show you the George Stephanopoulos Vivek Murthy interview, which is about 6.5 minutes long compared to 6 minutes of Dana Bash. This is just on getting answers from the Surgeon General on the rationale for the vaccine or weekly testing mandate. Basically, my analysis, I'll pre-criticize both clips together, I guess. My analysis is that George Stephanopoulos asks Vivek Murthy, the Surgeon General, things that aren't really his purview. I mean, I guess he is the administration official who came on to defend the policy, but asking him about the legality, the constitutionality, that sort of thing, that doesn't really fall within the job of the Surgeon General. I mean, asking about the messaging, I mean, because the Surgeon General is not just a doctor, he's a communicator, he's a messenger. So to ask the Surgeon General, as, I mean, both George Stephanopoulos and Dana Bash do, about whether this is the best messaging and the communication strategy, that's fine. But the legality, I think, goes too far, which George Stephanopoulos does in this. This is a 6.5 minute clip because I want to, like I said, juxtapose it with the 6 minute clip from Dana Bash coming up. Who wore it better, I guess. This is the who wore it better section, although I'm kind of going to do this with the two Republican governor interviews coming up. But here's George Stephanopoulos in the first of the who wore it better interviews of Surgeon General Vivek Murthy on the rationale for vaccine or testing mandates from the Biden administration over here.
You know, the president resisted issuing mandates for months. Thank you. The president resisted issuing mandates for months, and the administration repeatedly explained that he lacked the legal authority for sweeping mandates. So what changed?
Well, George, so let's talk about where we are and what the president announced. Fortunately, we have made a tremendous amount of progress over the last 8 months. I want to remind people of this because it can get lost in the news about the Delta variant alone. But because we have 200 million people, George, with at least one shot of the vaccine, we are in a much better place than we otherwise would have been. With that said, Delta is a tough foe. It's thrown curveballs at us, and we have to be prepared to respond. And that is why the president announced an ambitious and thoughtful plan that he earlier this past week, which is intended to help us get through the next phase of this Delta variant. Now, to be clear, the requirements that he announced are not sweeping requirements for the entire nation. These are focused on areas where the federal government has legal authority to act. So 17 million healthcare workers who operate in institutions which work with Medicare and Medicaid will now be required to get vaccines. We also know that the workplace requirements he put in place for workplaces that have 100 plus workers, that those will affect about 80 million Americans. Here's finally what we know, George. We know that these kind of requirements actually work to improve our vaccination rates. Tyson Foods, for example, which put in a vaccine requirement recently, saw that its vaccination rate went from 45% to more than 70% in a very short period of time, and they're not even at their deadline yet. So this is the next step, George, and in a series of steps that have to be taken to help protect our country from COVID-19 and help us get through this pandemic.
You've seen the opposition. I mentioned those 19 Republican governors. Here's Governor Ron DeSantis of Florida.
How can we get to the point in the country where you would want to have someone lose their job because of their choice about the vaccine or not? I just think that that's fundamentally wrong.
How do you respond to that?
Well, George, first of all, we have to put this in context. There are requirements that we put in workplaces and in schools every day to make sure that workplaces and schools are safe. For example, George, when you and I went to grade school, we likely had requirements for vaccines. we had to fulfill in order to participate in the classroom. That was part of keeping the classroom safe. I have worked for years in hospitals, and we had requirements to get vaccinated so we can protect our patients from infection. These are steps that we take every day that OSHA, the Occupational Safety and Health Administration, oversees. So this is not an unusual phenomenon. What it is I think, an appropriate response for us to recognize that if we want our economy to be back, if we want our schools to stay in session, we've got to take steps to make sure workplaces and learning environments are safe. And these requirements will help do that.
Several legal experts have said this is a novel use of the OSHA authority. Are you confident it's going to withstand constitutional challenge?
Well, certainly this wouldn't have been put forward if the president of the administration didn't believe that it was an appropriate legal measure to take. And I believe it is so based on the authority that Congress has actually given under the OSHA Act, which in fact provides, and not just provides, but tells the Department of Labor and the administration that they have a responsibility to ensure that the workplace is safe for workers. And that's what this measure does. If anything we've learned, George, over the last 18 months, it's that the COVID virus is a dangerous virus. It makes our workplaces and our schools far less safe than they should be. So this is an appropriate action, we believe, and it certainly, from a public health perspective, most importantly, will help keep workers safe, and that will ultimately help our economy as well.
You've seen calls from Senate candidates like J.D. Vance out in Ohio calling for mass civil disobedience. Are you concerned this might harden the opposition to vaccinations?
Well, George, here's what I think we have to remember, and it's especially important that we remember this on a day like today, the day after the 20th anniversary of 9/11. This has been a long, difficult pandemic. I know that it has generated a lot of anger, a lot of fatigue, a lot of impatience, among folks in the community over time, and that's absolutely understandable. But what we cannot allow, George, is for this pandemic to turn us on each other. Our enemy is the virus. It is not one another. And what we have to do is approach this next phase of the pandemic response, recognizing we've got to listen to each other before we rush to judgment. We've got to support one another in our decision-making and during times of crisis. 9/11, George, reminded us that we have the capacity to do that, as difficult as times may seem right now. After 9/11, George, I remember that day very clearly, and I remember people reaching out to strangers to support them. I remember people traveling across the country, George, to volunteer in New York City. That is the spirit of America that I know and love. We still have the capacity for that kind of approach, and it's what we're called on to implement in a moment like this, when we have to get through this very difficult pandemic.
The president seems to be getting it from all sides. There's also criticism from some who say he hasn't gone far enough, like Dr. Leanna Wen, who say that the president should have gone even further and imposed restrictions on interstate travel, saying a vaccination should be required for any kind of interstate travel. Some are suggesting that we should find a way to mandate vaccines for 12 to 17-year-olds. Your response?
Well, George, I think if you look at the substance of what the president announced, there's a tremendous amount in there and a lot of very aggressive actions that will help us increase the number of people who are vaccinated, protect those who are sick, and ultimately get us through this pandemic. We will always be looking for more measures that we can take, George, and that's as it should be. That has been our commitment from the beginning. But I do think that the series of measures taken here present a strong step forward, and they will ultimately help protect our communities. And that is the singular goal here. It's to protect us from COVID-19. It's help us get through this, keep our kids in school, keep our economy going, and give us a peace of mind that so many people have desperately wanted since this pandemic began.
Finally, how do you see the trajectory of the pandemic?
Yeah, so that's where George Stephanopoulos starts asking a different question. Where's the pandemic going? And that's something that can't really be predicted, although there's some people saying that there could be another 100,000 deaths or 60 to 100,000 deaths before the end of the year, depending on how well we get people vaccinated and masked and deal with this spread of the Delta variant, especially the pandemic of the unvaccinated, although there are breakthrough cases and there are even hospitalizations and deaths from the vaccinated, never mind people who just get really sick, none of which is going to be pleasant for people who took the step of getting vaccinated. Anyway, the criticism I had, I think you saw from George Stephanopoulos, was asking about the legality of the vaccine or testing mandate from the Surgeon General, who isn't a lawyer. And the thing about that is that all President Biden announced last week was that there's going to be that the Department of Labor's OSHA, in the Department of Labor, I was saying the Office of Safety, the Occupational Safety and Health Administration, is going to propose a rule that requires businesses with over 100 employees to either have their employees vaccinated or institute a weekly testing regime or whatever. But they haven't even created the rule, so no one can even tell whether, it's hard to challenge a rule that doesn't exist yet. But the Surgeon General, in his answers there to George Stephanopoulos, despite it not being his area of expertise, did point out how there is a strong government interest in protecting the health of employees where there are over 100 of them. That's a place where COVID could spread to a lot of people and they could all be vectors. That's the thing about the Delta variant, is that where it used to spread to like 1 or 2 people, now it's like 5 or 6 people, and it's much more transmissible. I think, especially since it's not requiring anyone to take a vaccine, because there's the possibility of just weekly testing, that there's I mean, like I was saying at the beginning of this commentary here, that it really depends on what rule is actually promulgated, but you have to read the rule first to know for sure. But I wanted to just comment on that from what Vivek Murthy said in that last clip, and then compare that 6.5 minutes to this 6-minute interview of Vivek Murthy on the same topic. You're going to hear a lot of the same answer, but I actually think Dana Bash did a better job than George Stephanopoulos. After we juxtapose the two of them, you can let me know what you think in the comment section, and I will talk about my analysis a little more with you after we watch it together over here.
I want our viewers to listen to what then President-elect Joe Biden said in December and what White House Press Secretary Jen Psaki said just this July.
Do you think the COVID vaccine should be mandatory?
No, I don't think it should be mandatory. I wouldn't demand it be mandatory.
And that's not the role of the federal government. That is the role that institutions, private sector entities, and others may take.
So, Doctor, what changed?
Well, Dana, it's good to be with you. And let's talk about the announcement and what prompted it. The announcement the president made includes a number of measures that will help us address the Delta variant. The requirements that we just heard about are one part of that, but they're only one part of that. It includes also measures to increase our testing capacity to shore up our hospitals and healthcare systems which are struggling with Delta. But what the president and what all of us have said as public health leaders from the earliest part of this pandemic is that we have to use every lever of government, and we all in the private sector have to do everything we can to tackle this virus. The requirements the president announced are an example of that. Earlier in the summer, the president had announced requirements for federal workers to attest to vaccination. And this is another step in that direction. Not only will federal workers now be required to vaccinate with an exemption for medical or religious purposes, but also healthcare systems that do business with Medicare and Medicaid. 17 million healthcare workers will be required. 80 million business workers who have 100 employees or more will also now be required under the OSHA rule, which was in process to either get vaccinated or to get tested regularly. So the key thing to understand, Dana, is number one, the data tells us that these requirements work to increase vaccinations. Number two, a lot of businesses are actually relieved that these are going into place, and we've heard a lot of feedback from the Business Roundtable and others that this will help create safer workplaces. But finally, Dana, keep this in mind. This is what we've got to do to get to the next phase of this pandemic response so that we can get through this and get back to normal once and for all.
So if these work, and this is what we've got to do, as you said, why not listen to what public health experts have been saying for a long time, which is that these mandates should have been in place a while ago. In fact, almost 60,000 Americans have died from COVID-19 just this summer. So if you were going to do it, should you have done it sooner?
Well, then I think that the aggressive actions of earlier this week that the president announced are not the only set of aggressive actions that we've taken in the administration. We've been working extraordinarily hard to vaccinate people. And not only that, well, we've made progress. 200 million people, Dana, have gotten at least one shot of the vaccine. And that's one of the reasons why we've actually saved many lives and many hospitalizations. Now, with Delta, which was a new twist, if you will, a new curveball, it has required us to take another set of actions, and that's what you heard the president announce. And there will be more actions that we continue to work on in the days ahead, especially on the global front, where we'll be taking steps and the president will be making announcements ahead of the UN General Assembly about additional measures that we're taking to help vaccinate the world. So there's a lot that's been done, a lot that we are doing now, a lot more we will continue to do, Dana. And this is what we have to do ultimately to tackle the Delta variant.
So I know you've heard a lot of Republican governors are saying that this is government overreach. Some of the Republican governors who are saying this, they largely work with your administration on the pandemic. Asa Hutchinson in Arkansas, Mike DeWine in Ohio. Does that give you pause, or are they just wrong on this?
Well, certainly I respect that people will have a variety of opinions on some of these measures, and we respect that. The governors have been extraordinary partners. Governors, Republican, Democratic governors, we've had the privilege of working with them closely over the last many months. And so, yes, from time to time there will be disagreements, on policies, but that doesn't mean that we don't stop dialoguing and working with one another. But again, the reason that we're pursuing some of these requirements is, again, we know a lot of businesses, have welcomed it. We know that many that will help keep workplaces safe. And Dana, if we ultimately want to not only get people back to work, but keep them at work, if we want workers to know, hey, I'm coming back to the workplace and it's going to be safe, these vaccinations will help people do that. And I believe that will not only improve public health, but it'll give people some more peace of mind.
The president's new plan, as you know, has some exemptions. And some of the exemptions allow for people not to get the vaccine for medical or religious reasons. Any concern that people will abuse those exemptions in order to avoid getting the vaccine?
Well, then, that's while that's always a possibility, it's something that we have fortunately have experience with as a country. We've had vaccine requirements for a number of other illnesses. We do that in schools, for example. When you and I went to grade school, we likely had to make sure and confirm that we had certain vaccines in place before we actually came to school. So fortunately, as a country, we have experience in dealing with exemptions, but we've got to be vigilant there and make sure that people are using them, in the spirit that they're intended, and not, abusing them or asking for exemptions when they don't apply. That'll be an area that we continue to monitor in the days and weeks ahead.
The government is already mandating masks to travel on a plane or a train. But I don't know if you've had this experience, but I've been on planes recently. You're sitting there, people lift up their masks to eat and to drink. That's understandable. So given that reality as a public health official, would it be a good idea to mandate the vaccine for travel on that plane or on a train?
I found that last question kind of amusing because it almost seems to me like Dana Bash is like asking the Surgeon General, you think you could come on my next flight with me and tell that person sitting next to me that they need to get vaccinated? Because they keep lifting up their mask and it's making me nervous. But it was kind of more of the questioning that you saw from George Stephanopoulos as well. Sort of I guess on the vaccine mandate, if you're going to have it as a two-sided issue, you might have it from a public health perspective, like, did it not come soon enough is really the stronger question, because things have been going pretty badly with this Delta variant for months now. It could have been sooner, and it could have been could have been stronger, could have been applied to more people. But I think, as Vivek Murthy said in his answers to both, I think in both of them there, he talked about how this is going to be targeted, like I was saying, at the places where where the administration and OSHA have the authority, in businesses over 100 people where there could be spread of COVID. And one of the things Vivek Murthy also said, the Surgeon General, in those last clips, he said that vaccine mandates work to get more people vaccinated. And I don't know if that's true. And I'm not even sure if there is scientific evidence for that. It's almost like if there were scientific evidence, it would be in sort of the science fiction sense. Like, did anyone read Isaac Asimov's Foundation series? I think on Apple TV Plus, is it later this month? They're gonna put out a version of that. I actually really enjoyed it, and one of the premises of the whole series is that there are these scientists who can like predict. They can't predict what individuals are going to do, but they can predict what like societies are going to do over large periods of time, and so they try to like stop the galaxy from falling or going into chaos or whatever. That's kind of the premise of the Foundation series, and I'm kind of looking forward to watching the Apple TV Plus series and see if they do it justice. I was an Isaac Asimov fan, just like I was a Star Trek fan, because you can see my Mr. Spock mug over my left shoulder for many of my episodes, well, all my Monday Media Mix-Ups. And anyway, so the ability to predict how a specific policy is going to affect whether people, it's going to harden people's hearts so they won't get vaccinated, or is it actually going to make people say, well, I guess if I have to, I have to. And I think it might be more the latter than the former, but here's a different scientist, Dr. Scott Gottlieb, who I've featured, or who CBS News Face the Nation has featured almost every week, it seems like, in the whole pandemic. He's on the board of Pfizer. He was in the Trump administration as the head of the FDA, but he's generally had good information. But like I said, I'm not sure this is a scientific question. If science can answer the question as to how vaccine mandates will affect people's decision-making in terms of whether to get vaccinated, or, the vaccine mandate or testing. But here's Scott Gottlieb sort of giving the opposite perspective. From a scientific perspective, I don't know. You can let me know what you think after we watch that clip together over here.
Look, states can mandate vaccines. Federal government has never done something like this before outside of the U.S. military. The Republican governor of Arkansas is on TV today saying this is going to backfire. He's trying to convince his constituents to take the vaccine, and because the federal government's telling them to, he says it's going to be even harder. Practically speaking, does this mandate make sense?
I think the downside of this mandate in terms of hardening positions and taking something that was subtly political and making it overtly political could outweigh any of the benefits that we hope to achieve. If you look at where we are right now, 75% of adults over the age of 18 have had at least one dose of the vaccine. Most of them will complete the series. That's a very high number of people vaccinated, owing to the good work of the Biden administration. We're not going to get above 90%. We don't even really reach 90% with childhood immunizations, which are mandated. So we're going to get somewhere between 80 and 90%. I would state that we would have gotten to 80% just on our current trajectory in short order. Perhaps with a mandate on small businesses, eventually you get to something akin to 85%, but it's going to be slow because this is going to get litigated. It takes OSHA time to implement regulations. You'll have to put in place guidance, give businesses a grace period, and then figure out what the enforcement mechanism is going to be. And in the near term, a lot of businesses that might have mandated vaccines are now going to sit on their hands and say, I'm going to wait for OSHA to tell me just how to do it and give me more political cover. So in the near term, you could actually discourage some vaccination.
Right. OSHA, that's going to come from the Labor Department, and they haven't filed that yet. That's what you're referring to. But the president, what he said was mandating a vaccine for businesses, and if employees at those businesses don't take it, the alternative is to get weekly testing. Do we have the testing capacity in the country to do that right now?
We would have the testing capacity to do it, but it puts a big burden on businesses to have to operationalize that and determine what they're going to do with the results. So I think a lot of businesses are going to opt to try to force workers to get vaccinated, if in fact this ever goes into effect. But again, we're looking at a very long timeline here. Excuse me?
Many already were, right?
Many were, exactly. Many businesses are, and I think that the federal government's action to require federal employees to get vaccinated, which is probably well within their purview to do that and a function of federal readiness, that gives plenty of political cover for more businesses, more private sector businesses to start to implement their own mandates. So I don't think we had to reach down to the level of small businesses with 100 or more employees and put a federal requirement on them. I don't think the federal government should be dictating this. I also don't think governors should be preventing small businesses from making these determinations on their own. We should leave these decisions to communities, local communities and businesses to make assessments on what what their risk is, what their settings are, how much precautions they can put in, whether vaccine requirements are an absolute necessary to protect people in those settings.
Well, kids still can't get a vaccine if they're between the ages of 5 and 11.
And actually, that next question from Margaret Brennan, which I didn't keep the clip playing because it wasn't about the vaccine or testing mandate, which is my topic, but you'll see if down at the link in the video description under the sources heading, I have the link to the CBS News Face the Nation YouTube channel, where the entire program is split into segments, including the entire interview with Scott Gottlieb, so you can watch the rest of it and see where he says that he thinks maybe by Halloween they will have the vaccine approved for emergency use for kids going all the way down to age 5, which will be good for schools and good for stopping, especially there are a lot of parents who are scared about sending their kids who are between the ages of 5 and 12 to school, especially schools where there aren't mask mandates, or who knows what the precautions are going to be. And like I was saying earlier in the live stream, this Delta variant does, I mean, the data is still coming in. It's a new situation, so sometimes it's hard to tell whether it is more damaging to children or just more children are getting it because that age group 5 to 12 is a prime spot of unvaccinated people that the Delta variant can spread through. So that's two different interpretations of the data, and I'm not sure which is accurate, and it's just that'll take some time to figure out. But I did want to before I get to the two governors, I wanted to point out one last time, Scott Gottlieb has one view as to whether vaccine mandates get more or less people vaccinated. The Surgeon General, Vivek Murthy, gave the opposite view as to which is true, or whether anyone can actually know without doing it. I don't know if there is a way to predict that without actually doing it and finding out, but I guess we're going to find out when we see the rule that OSHA puts forth, and whether more people get vaccinated or less, or what happens, only time will tell, I guess. But anyway, the next two clips, the final two newsmaker clips, before I get to my bonus Dash and Sandy or Dandy clip for the fans of my dog Sandy and my cat Dash out there. These last two clips are the two governors, being two Republican governors. You know, there was that whole thing about 19 governors immediately opposed President Biden's vaccine mandate, even though it's a vaccine or testing mandate that where the rule hasn't even been created yet. This is Chuck Todd talking to Arkansas Governor Asa Hutchinson about his opposition to the mandate. And you saw that in that last clip, Margaret Brennan asked Scott Gottlieb about Asa Hutchinson saying exactly what Scott Gottlieb said. He makes the same argument that it's going to make it harder, or it's going to make fewer people get vaccinated. The vaccine or testing mandate will result in fewer vaccinations, which, as I've been saying, my prediction would be it gets more people vaccinated, but I don't know if there's a way to answer that question scientifically through evidence or without doing it and finding out. One thing I will say about this now, I almost used this beginning of this next clip as my political comedy, because first Chuck Todd talks about how he asked 19 governors, the 19 Republican governors who opposed the Biden mandate, to come on the program, and he got one. You'll see Chris Wallace in the next clip gets one other. But then he gives us some insight. I know there are a lot of Chuck Todd haters out in my audience. I don't know why. I'm not, like a huge Chuck Todd fan, but I'm not a Chuck Todd hater. I kind of like him. I'm not saying whatever. I don't know why people hate Chuck Todd so much, but at least Chuck Todd now is going to give us a little insight in what is it like to grow up with the name Chuck Todd. We get to get a little insight into the lived experience of Chuck Todds everywhere in the introduction to his cross-examination of Arkansas Governor Asa Hutchinson on yesterday's program about his opposition to Biden's mandate for businesses with over 100 employees to either vaccinate their employees or institute weekly testing, over in this clip.
I want to turn now to the Republican reaction. By Friday morning, 19 of the country's 27 Republican governors had condemned President Biden's mandate plan, calling it a federal overreach. More Republican governors have joined in opposition since then, but we invited the original 19 to come on Meet the Press. 18 chose not to accept our invitation, but thankfully one did agree. It's Asa Hutchinson of Arkansas, and we are grateful that he did. Governor Hutchinson, thank you and welcome back to Meet the Press.
It's always good to be with you, Todd.
Let me ask. That's all right. It's all right. When you're born with two first names, that's the those are the breaks. We've had more than 650,000 people have died. It's 200 times the amount of people that died in 9/11. If not now for a federal mandate on businesses, when? Because this feels as if we're up against sort of the last. This is the last tool in the toolbox.
Well, I appreciate what the Surgeon General had to say, and we have to overcome resistance. This is a very serious, deadly virus, and we're all together in trying to get an increased level of vaccination out in the population. The problem is that I'm trying to overcome resistance, but the president's actions in a mandate hardens the resistance. And we talked about the fact that we've historically had vaccination requirements in schools, but those have always come at the state level, never at the national level. And so this is an unprecedented assumption of federal mandate authority that really disrupts and divides the country. It divides our partnership between the federal government and the states, and it increases the division in terms of vaccination when we should all be together trying to increase the vaccination uptake.
Governor, do you really think this is what's increasing our divide? I mean, realistically, it feels like this divide's pretty hardened here, and at the end of the day, it did seem as if there were a lot of private businesses that wanted the political cover. They wanted to do their own vaccine mandate, which you're supportive of. You think if a business wants to do this, you have said you don't want to stand in the way of that, like other governors have done. Given that, isn't it the responsibility of the federal government in some ways to give some cover to businesses that would like to enact this but are afraid of the blowback themselves?
Well, we'll see whether it's actually constitutional or not. I've never seen this type of federal action in terms of health care, in terms of vaccinations. It's always been done at the state level. And let's think about this for a second. We have some very aggressive governors from blue states, but I'm not aware of any governor from any state that said we want to mandate businesses to require vaccinations. And so the states, none of them have done that, and yet the federal government steps in. This is something that every state has to make decisions on. I support businesses being able to require vaccination, but it's their own independent choice for their workplace. But to have the federal mandate will be counterproductive. It's going to increase resistance. We're going to grow our vaccinations whether you have this or not. We're increasing them in Arkansas, and we're going to be able to increase them nationally, but this will make it much more difficult and will increase the divide. In my judgment, we've been divided over masks, but we've been more unified in terms of vaccination. Not totally, but more so, but this will not help us.
But Governor, you yourself went on this tour, and we've seen some, and you've expressed your own frustration at the misinformation that had clearly gotten around, particularly in the rural parts of your state. You know, there was nothing else was accelerating the vaccine pace other than dead bodies, right? Unfortunately, the one thing that does seem to work in persuading people is when they have a family member who dies from COVID.
Our vaccination rates went up 40%, both because we were providing better information, bringing in trusted advisors to the public, but also because of the risk factor, as you point out. And so, yes, as the risk goes up, vaccinations increase. That's a little bit of human nature. But it's all about the trust factor. I tried to build it by bringing in community-respected leaders in the healthcare profession to talk to and to get over some of the hesitation. But it was clear to me from the very beginning the distrust is with government. This enhances the distrust in a state like Arkansas. You know, other states can make their own decisions, but it shouldn't be a federal government one size fits all across the country.
Hey, before I let you go, I'm curious what you thought of what former President Bush said.
And I kept that playing just to that last part. I mean, before I get to why I kept it playing, well, I should explain that before I forget. He asks Asa Hutchinson in the next question that I don't show about the statement George W. Bush made in Pennsylvania on the anniversary, the 20th anniversary of the September 11th attack, where that one airplane, Shanksville, Pennsylvania, where it crashed. The only former president to speak was George W. Bush, and he likened the terrorists on 9/11 to the insurrectionists on January 6th, or in a subtle way anyway. And I just wanted to mention that because that got brought up on NBC, did not get brought up on Fox News Sunday. My next and final newsmaker clip is from Fox News Sunday, even though they had a panel discussion about the September 11th commemoration on the 20th anniversary, including they had a clip from Shanksville, and they had Karl Rove on. Karl Rove from the George W. Bush administration. Nobody ever mentioned George W. Bush's speech at all, never mind his comparison of the 9/11 hijackers to the insurrectionists on January 6th at the Capitol. So I just had to mention that, and that's why I played the clip as long as I did to that question, not on my topic. But I think you saw there that Chuck Todd did a pretty good job of cross-examining Asa Hutchinson on why he opposes the vaccine or testing mandate. Didn't really talk that much about the testing loophole, though at least Asa Hutchinson didn't say anything specifically that brought that up. The one other criticism I guess I would have of his cross-examination is he was making the same argument that Scott Gottlieb made in the previous clip, that the vaccine mandate is going to increase distrust in Arkansas because people distrust the government or the federal government. That is an assertion, but is there evidence that shows that? Because I think for a lot of people, if I guess if I got to do it to keep my job, I don't want to have that thing shoved in my nose every week, I guess I'll get the vaccine. But anyway, I was looking for my little sticker that says I got vaccinated, but it's around here somewhere. Wait, is that it? No. Anyway, I can't find it, but I got as I have documented, I got my second Pfizer vaccination back at the beginning of April. I'll probably be getting my booster in December. So anyway, you can let me know what you think in the comment section as to the strength of that argument you heard from Asa Hutchinson and from Scott Gottlieb, that the vaccine mandate will actually result in less people getting vaccinated. But I was talking about that whole thing of the mandate being vaccine, employees have to be vaccinated or weekly tested. And I even put that in all caps in the title of my live stream this week. And I mentioned earlier when I showed the Fox News Sunday news summary that they made it clear that they went into all the particulars of what Biden was proposing. They mentioned it was for businesses with 100 plus employees, and then those businesses either had to have the employees vaccinated or weekly testing. And I said earlier, Chris Wallace, then when he's cross-examining or interviewing the governor of Nebraska, Pete Ricketts, somehow he doesn't bring that up ever, even though, I didn't want to. This clip is 7 minutes long. It's the final newsmaker clip. And I cut out the part in the middle where Chris Wallace actually does a good job of cross-examining the governor on how the cases in Nebraska have skyrocketed. I leave just a little bit of that in where it shows like a few months ago, just like 25 cases, now like a day, now like 750 cases a day. And given that there's almost nobody in Nebraska, that is like crisis level cases. And then he talks about how they're running out of hospital capacity, which is the governor's big argument. Oh, we're just making sure we don't run out of hospital capacity, which just means we just want people dying slow enough that they don't overfill our hospitals. That's kind of the whole flattening the curve, but not lessening the epidemic theory that some people were talking about way back in March, April, May of 2020. Anyway, like I said, my big criticism here of Chris Wallace is there a couple times in the two pieces of the interview I've edited together here, you'll see the governor of Nebraska say, I keep talking to people and they say, well, if I have to get vaccinated or lose my job, I'm just going to lose my job. So many people are going to lose their job. And wouldn't that be a perfect place for Chris Wallace to say, well, if they really don't want to get vaccinated, they can just do the weekly testing. Never comes up. And anyway, I'll talk about that and a few other things about this interview, I guess, a little more after we watch the final Newsmaker clip together over here.
I want to start with something that you said this week about President Biden's new vaccine mandates. Here you are, sir.
The president's forgotten we live in America. He thinks we live in the Soviet Union. And the hypocrisy of this is just unbelievable.
Governor, what's so objectionable about Biden's vaccine mandates, and what are you going to do about it?
Well, first of all, we have been encouraging people to get vaccinated. We've been providing information and encouraging people to reach out to their neighbors because vaccines work and they will help people. But it should be a personal health care choice. This is not something that the government should mandate, and somebody shouldn't have to make the choice between keeping their job and getting a jab in the arm. I mean, it's just wrong. I've talked to people, a number of people who have told me if they make me take the vaccine, I'm just going to be fired. I'm not going to do it.
But you say it's a personal choice. In fact, to attend school in your state of Nebraska, children must be vaccinated against a number of diseases. Let me put them up on the screen. They must be vaccinated against diphtheria, tetanus and pertussis, polio, measles, mumps and rubella, hepatitis B, and chickenpox. Why are those mandates that parents in your state must comply with and do comply with routinely, why is it that they're not so objectionable and such a violation of personal freedom, but Biden's vaccine mandates are?
Well, for all those that you just listed, there's a long history that parents have had the opportunity to see how those things have been implemented. And there's still a lot of people out there who don't know what to trust. And in fact, this is really an outcome of what the CDC has done, because they've flip-flopped on so many issues, whether it's masks or whether you have to mask after you've been vaccinated and so forth. There's just a lot of people out there who don't know who to trust right now. And so by having the government force it on, you're not building the trust where we have the trust with those other vaccines. This is a process that's going to take time to bring people along, and that's why it should be a personal choice and not something mandated by the government.
But forgive me, sir, I'm old enough that I remember when the polio vaccine first came out, a lot of us, and certainly our parents, viewed it as a blessing, and immediately, I lived in New York State at that time, the state mandated that we all get the polio vaccine. So, we're in the middle of a pandemic. There is a new vaccine that Donald Trump was largely responsible for. It's been approved, full approval by the FDA. Again, if the polio vaccine is okay for parents and they have to comply with it to send their kid to school, why not for a lot of people, not just kids, the vaccine for this disease?
Yeah, and I think this is very different from polio that has very devastating effects. And certainly we know if you're older, 65 years and older, that's where 83% of our deaths in Nebraska came from. We know this is really devastating. But we also know that nearly 87% of our 65 years and older population has been vaccinated. And if you're looking at young children, for example, here in Nebraska, we can look at the data and see that really children are no more at risk for the coronavirus than they are for the ordinary flu. And so it's all about balancing off these risks. And the risk for this is just such where this is something that we shouldn't be mandating it. Again, the whole goal for all we're doing, at least in Nebraska, how we're doing it, is around making sure we're preserving hospital capacity. And we've successfully done that here, even without doing statewide mask mandates and without doing vaccine passports. So let's keep the objective in mind, which is to be able to provide health care, and which we've successfully done here in Nebraska by protecting our hospital capacity, and not have the heavy hand of government come in and tell people what to do. They just don't want to hear it.
President Biden was asked on Friday about leaders, governors like you, who say they're going to challenge him on the vaccine mandates. Here's what his response was.
Have at it. Look, I am so disappointed that particularly some Republican governors have been so cavalier with the health of these kids, so cavalier with the health of their communities.
Governor, are you being cavalier with the health of your communities?
What we're doing is focusing on preserving our hospital capacity, which we've successfully done here in Nebraska. We're tied for the third lowest mortality rate of any state in the country for people who have contracted COVID-19. And so we protected that hospital capacity to provide that care. And again, we can look at the data specifically around children and see the risk. Last year in Nebraska, if you were aged 10 to 19, you were 26 times more likely to die in a car accident than you were of COVID-19. So the president should look at the data, and maybe the president should attend one of the weekly calls his administration has with all the governors. He's not been on one yet since he's been president, and maybe talk to some of the governors and ask them about what's going on in their states, because he appears to be pretty ignorant of what's going on in places like Nebraska.
Let's talk about the COVID situation in your state. And again, it's not just about kids, it's about the entire population. Let me put the stats up on the screen. Back in June, Nebraska was averaging 23 new cases a day. Now, with the Delta surge, you're averaging 759. So I asked you a question at the top. I asked you why it was so objectionable. You answered that. You didn't answer the other question. Let's finish with that. What are you going to do about President Biden's vaccine mandates?
Yeah, so I've been talking to my attorney general. He's coordinating with the other attorneys general across the country who share similar views about the overreach. This is an egregious overreach of federal authority. And as we see what these rules are, we will be able to know exactly how we will be able to challenge them in court. I'm also talking with my colleagues around the country as well, the other governors who feel the way I do, and we'll be working on other strategies. But I got to tell you, I have heard from so many workers, so many small businesses who say this is just not going to be something they can handle. So many people have told me they're just going to be fired if they're forced to take the vaccine. This is really going to create huge problems for our small businesses and for our American workers. And again, you shouldn't have to make the choice of keeping your job or getting a jab in the arm.
Very briefly, you say you're going to court. Any idea how soon?
Well, when we get an idea of what these rules exactly will be, we'll know how to be able to attack it in court.
So you saw there with the parts I edited together, both at the beginning and then right near the end, the part I pre-criticized Chris Wallace, letting him get away with saying, I've talked to so many people who say they're going to be fired because they won't get vaccinated, and Chris Wallace never brings up the fact, well, why don't they just get tested every week instead? They brought that up in the news summary, didn't bring it up in that interview, but I made several notes of other things I wanted to talk about from that interview that I didn't mention in the pre-criticism. I first thought that it was kind of ridiculous for Governor Ricketts to say that unlike school vaccinations, that, you saw Chris Wallace cross-examine him in a good way about how schools require all these vaccinations to go to public school. What about those? And he says, well, there's no track record. Well, of course, there's no track record for a vaccination until, for a vaccine mandate, until you put in the mandate and then you start the track record. And one of the most amusing parts of that clip for me anyway is like he mentions polio and Chris Wallace says, he mentions polio to Chris Wallace, forgetting that he's going to get, well, you know, I'm so old, I remember polio, and people wanted to get the vaccine, and that's when they first started the track record. And I also thought, I'm not so old, I don't remember polio, but I guess that is one saving grace I have in terms of in the age Olympics with Chris Wallace of Fox News Sunday. But I also thought that Chris Wallace then, after bringing up the polio thing and letting sort of the governor get away with saying, well, you know, the effects of polio are so devastating. Well, the effects of COVID have been pretty devastating. And Chris Wallace also said, you know, Trump was mostly responsible for the vaccine. I mean, is that really true? You think, you know, President Trump was like in there with his like beakers and Bunsen burners, and he was, you know, within his white coat down in the basement of the White House, like mixing up everything. So we got the mRNA vaccines are the result of a long-term investment in science that predates the Trump administration, if you want to be honest about it. I mean, Trump says he cut all the regulations so that they did it faster, and I don't know, there might be some truth to that, and they made some bets on buying certain amounts of vaccines from various companies before they knew whether the vaccines would work. That is the one thing I would give the Trump administration credit for, is spending the money on vaccines they didn't know whether they were going to work or not, that turned out to work. But they still didn't buy enough to vaccinate everyone. The Biden administration had to do that. They didn't have a distribution plan. The Biden administration had to do that. But so that was another thing Chris Wallace said that wasn't actually accurate. And he also let the governor of Nebraska there get away with talking about the data on the young children shows that they're not at risk. And at one point he even says the data from last year, they're more likely to die in a car accident from COVID, but it wasn't the Delta variant last year. And there is some data showing that kids are actually hurt more by Delta than the previous strain. Although, like I was saying earlier, it might just be that they're the vulnerable group, because the 5 to 12-year-olds can't be vaccinated yet. He did cross-examine him on the hospital capacity. I cut that part out, so I have to give Chris Wallace credit for that. And he was the one person to get someone to say, well, there's no rule yet to tell us, you know, the Biden administration hasn't even promulgated the rule, so what are we going to sue on when they haven't even put a rule out? Anyway, that is the last of the Newsmaker clips. I did want to thank the Super Chat contributors I saw so far here. Let me just... Thank you, Lulu Girl and Clip Culture. I'm glad you both were able to catch the show live. And before I show the Dash and Sandy clip, I saw people talking about my shirt. This is a new shirt that I got near the beginning of the program, and this fits right in with the Dash and Sandy motif, because none of you seem to have noticed that there are dogs on my shirt here. I took a picture of my own shirt. Here's a close-up. Some reason that picture turned out upside down, but I think if you looked at it closely, there are dogs on my shirt, so that is a good way to introduce the Dash and Sandy clip. Last week I showed how Sandy the dog will not eat her food anymore unless we put some sort of topper on it. I bought this like bone broth at Whole Foods that is kind of overpriced, but I think I'm just going to get regular, you know, supermarket broth to put on it, because if you just wet it down a little, she'll still eat it, which is what I'm going to demonstrate. I didn't show that last week. I just showed how Sandy the dog wouldn't eat her food, and then Dash the cat came in and ate it instead, and I told you how I then put something on top to make the dog eat the food. Well, Now I'm going to show you that part of the process for the Dash and Sandy or Dandy clip to finish the show today. Over here. And there you have it, the Dash and Sandy or Dandy clip to finish the show. I appreciate all of you who showed up for the live show. Oh, and thank you, Mary Wayne, for the $10 towards the Cool Shirt Fund. I hope you appreciate the cool shirt. Yeah, that this was one that my wife picked out for me specifically to wear during the live stream. So you can thank her for that. Anyway, I don't want to go into that long story as to where this shirt came from. Maybe next week or next time I wear this shirt, I'll give the where did this shirt come from story. But anyway, that's it for this week. I will be back next Monday and every Monday for, I don't know, at least 2 or 3 more months, I think. Probably, yeah, I guess through the end of 2021 at least, and then reassessed. I don't know. I said through the summer, and now there's only like a week left of the summer, technically, till, those of us who know when our solstices and equinoxes are. Anyway, I'll talk about that more in the weeks to come. I'll be back next Wednesday, hopefully at noon next Wednesday. Next Monday. I'll be back next Monday for the LiberalViewer Monday Media Mix-Up. Next Monday at noon. And until then, I guess I have gone on too long. I'm starting to think of other things. But until next Monday at noon, I will be seeing all of you around the internet.